Okay, well, good morning.
Good morning.
How are you doing?
Good.
Good. It is very nice to see you. As you well know, I always say, and welcome to everybody who's going to be coming up, watching the replays, all of our new people who we have a lot of. I get rid of this thing here. We have our questions, Dr. Rosensweet, that you so eloquently answer, and I'm going to go ahead and get started. And certainly appreciate your kind time always.
Good to see you, Carolyn.
Oh, it's really good to see you too. Always, always. Um, Dear to my heart. So let's start off with question number one. How about that?
Good.
It's a good idea, right? Okay. A woman had stage 1 breast cancer. And this was some time ago. Um, Taking hormones 20 years, and has found that she has now a stage 2, close to stage 3 breast cancer. Her doctors took her off of all of her hormones, insisting that this cancer is due to hormones and is definitely estrogen fed. She's frightened, very confused, and also miserable without her hormones. Having a lot of fear and being very confused, wondering what your thoughts might be about this estrogen fed part. Having read Happy Healthy Hormones, Estrogen Matters, and a few other books too of note.
Challenging.
I
Challenging
know.
question. I mean, the huge challenge is to a woman who had a breast cancer and then had a recurrence. There's the real challenge there.
Yes.
And
Hey.
and
Oh, you're freezing.
and frozen. Are we frozen?
Yeah.
Are we frozen, Carolyn?
Now we're not. We were, but now we're not.
Good. And when you're dealing with an issue so profound as an illness that can be severe, and by the way, also can be healed. And, there's thousands and thousands and thousands and thousands of women who have healed breast cancer. And by that, I mean, some of them did it with major assistance of surgery, chemo, and radiation. And some of them did it with alternative methods, and some of them did a combination. And, throughout the history of human beings, healing is possible. I'd like to start there. And then the question is, what in the heck caused that cancer? Because hormones don't cause cancer. They're some of the most powerful and beneficial biochemicals that are in our body. And without them, we don't get to walk and talk.
Yes,
At least. And yet cancer has causes. And the best resource out there that's been written about risk and hormones, so well, it's an old family friend of yours, is a book called Estrogen Matters by Avram Blooming and Carol Tavris. Dr. Blooming is an oncologist who specialized in breast cancer. And this is an excellent book, and I so recommend to this patient that she read this, if she hasn't already, because the prevailing thoughts and commentary and opinions about treating women who've had breast cancer with hormones, almost everywhere you turn, there's the leading with what I would call a misconception that hormones cause cancer, and they feed cancer and they make it grow. And Dr. Blooming is one of the few medical doctors that I'm aware of that's actually done studies on women who've had breast cancer, had the breast cancer properly treated by radiation, chemo, surgery, and then has done a medical study on women who are then treated with hormones with very favorable results. And he's highly regarded. And he was just given the editorship for a single issue of, I think it was Cancer, the journal Cancer. He's well recognized in the field to be an expert. And his commentary on does estrogen feed estrogen positive receptor site cancer is very gray area. And I've talked to him personally about this very question. And one of the comments was, for one thing, he couldn't distinguish it. Like, he started doing his study treating women who had had breast cancer properly treated, and then him treating them with hormones in the 80s, if I've got the dating right, but certainly long before there was anything known about receptor sites. And the receptor sites were discovered in the late 90s and were brought into clinical practice and assessed in women who have breast cancer. And he said that you can't really tell. In his opinion, and hopefully I'm quoting him accurately, that when you look at an individual cancer, there's all kinds of cells in there, an individual tumor. There's cells that are very primitive. Those are the most challenging of the cancer cells. They're out of control. Their growth is out of control. And there's the cells that look like normal breast glandular tissue. And it's the cells that look like normal breast glandular tissue that have the estrogen positive receptor sites. And he says they're not the problem in the cancer that's been removed. Those cells are not the problem. It's the undifferentiated, out of control, primitive cells. And so he says the whole area of whether treating women with receptor site positive with hormones or not is a very, very gray area. Gray. And I think it'll continue to be gray because this is the way I like to describe, and you've heard me say this several times before, how illness is caused. And I like people to pretend that there was a videographer who videoed them from the moment they were conceived right up to this very day, 24/7, even in the womb. And the videographer had a magic button with all the footage. So 60 years of footage, 24/7. And the videographer pressed this magic editing button in which all the good stuff, all the healthy food, all the healthy exercise, all the love, all the fun, all the family, all the pleasure, all the creativity was edited out. What would be left behind would be all the indiscretions of nutrition, all the toxic exposures, all the too little or too much exercise, and so much so the elephant in the room, all the exaggerated, unbeneficial response to the stress of life. I'm not saying the stress of life. Human life is stressful, and it's good, and that's a big topic, and I'm not going to try and explain that. What gets people in trouble is not the stress of life. It's if they have an exaggerated, dysfunctional response to the stress. The stress makes us strong, helps us grow. But it's also possible to have a small, medium, or huge dysfunctional response to stress. That triggers the fight or flight biology. That's very detrimental to the health. So the video that we would be viewing, all the left behind, all the causes of major illness that affect the immune system, for example, we're producing cancer cells all the time. No problem for a young, healthy person or a healthy person. We've got a strong immune system. The immune system looks at those cancer cells, says, sorry, you got to go somewhere else. We're going to dismantle you.
Asta.
So you need a really vigorous immune system at least. And what does the exaggerated fight or flight response do? It suppresses the immune system for good biological reasons. It's survival reasons. And so I don't want to make it sound too complex. There are thousands and thousands of causes when someone gets ill. Thousands of life events, of choices, of events that lead to the strain and stress and challenge to our health. And they count and they add up, and they can produce thousands of different diagnoses, medical diagnoses, including cancer. This is why so many areas about cause are so gray. Whereas the hormones don't cause cancer.
And yet,
now here you have a woman who had a cancer, then got treated with hormones, then had a recurrence of the cancer. And how, like our method, we treat women who've had cancer, provided they've had the cancer properly treated. And I'm very aware that it can be a challenging process to get a cancer properly treated. But many people come out the other side. And there's even things like women are told that you're past your 5-year survival, you're cured. And there's, I don't know how many thousands or hundreds of thousands of women are out there. They had breast cancer sometime in their past, or other cancers, or men had other cancers. And they're alive and well and functioning. They healed it. Healing is possible.
I love when you say that.
Healing is possible.
I love when you say that.
It's really profound, isn't it?
It is.
It puts us right up against any fear that we have that healing is not possible. And that's a prevailing human fear.
Yeah.
And it's a core illness that we have. It's an illness of consciousness. It's an illness of perception. And what we think about things and our attitude and what we feel is meaningful and it has effect. So I remember the very first woman that came to me, she had had breast cancer, and she wanted me to treat her with hormones. This was in the early 2000s. And I knew that it was risky for me as a physician because I knew the medical community does not look favorably upon that, especially back then. Whoa.
Oh, yeah.
But I wanted to know what the truth was for the woman. And one of the things that she had done in the course of treating the breast cancer, surgery and chemo, she had done what one could call some deep spiritual work. She got a tremendous amount of assistance and professional assistance with her emotions and her mind and her life. She put her shoulder to the wheel, so to speak, and had the courage and commitment to try and figure out how in the heck did I create this? And she grew enormously from this. And I think it's an interesting thing that the cancer itself, whether you serious illness itself, often refines the soul in ways that it itself is a healing process. Funny thing to say. I had a mentor, a teacher a revered teacher once say to me, "Don't ever judge someone who's ill, because you don't know that is the very thing their soul might need for the softening, for the opening." It's all part of life. Easy to get philosophical about it. Not so easy when you're in the midst of it. And I have compassion for this woman who has this issue.
I do
Now,
too, and in a big way.
so here she is. She's seeking out healing and treatments for the recurrence of the cancer. And many of the physicians that are involved in that process are not going to be expert in hormones, and they're not going to be up to date on the actual risk information. They're going to be deeply disturbed by false reporting of the Women's Health Initiative, which was false. It was false. What was false was the report in 2002 was women who was treated with hormones had an increased risk for breast cancer. That was false. That was false in the original study. There was no statistical significance to one of the arms of the study, but it poisoned the mind and attitude of women all over the planet, as well as physicians who are prescribing to them. And although that information was shown to be false right in the beginning, anyone who read that study, like myself, we saw severe faults in that study, including that they did not demonstrate statistically significant increased risk. They didn't do it. The press grabbed it, spread it like wild, and there was physicians involved in that as well. But the evidence wasn't in the paper itself. Well, I saw that, and some of my colleagues saw that, and then gradually over the years, as they were re-examining the data and doing the follow-up on the women, well, in 2017, the original study committee published in the original Journal of the American Medical Association that after 18 years of follow-up, there was no increased risk. But the damage has been done. So unless you're a healthcare provider that is taking this on a specialty, it's quite unlikely that you've been exposed to the latest information that women who had breast cancer and had that breast cancer properly treated, they happen to be at greater risk for recurrence of that breast cancer than a woman who's never had breast cancer is for getting breast cancer. But if a woman has had breast cancer, had that breast cancer properly treated, she's at less risk for recurrence if she's treated with hormones than if she's not. That's the science. That's the medical study. Now, there's always exceptions. There is no 100% in medicine. And there can't be, because the reasons why we get life-threatening illnesses run silent and run deep. And they don't have to be silent when people really take the courageous effort of going into therapy, hooking up with a knowledgeable psychotherapist, or does group therapy, or Alcoholics Anonymous, or all the wonderful, wonderful organizations that are totally devoted to the healing of the hurt human soul.
The hurt human soul.
The hurting human soul.
Or the hurting human soul.
Yeah. They're everywhere. Those that do that are doing the great work, and we need to heal this stuff. And so the first question that I always ask when I used to meet up with women who had breast cancer is, did you find out how you got this? And have you explored this with a therapist, or with group therapy, or with AA, or with a pastor, or a priest, or a social worker? Those who devote their life as a profession to trying to help people with matters of the heart, matters of the emotions, matters of the mind, matters of life. Because therein lie the causes. So it's possible that this questionnaire has got another round to do.
Right. And I'm going to interject this because it's question number 2, and you're getting into question number 2, so I really won't even have to ask it. But the one thing that I do want to bring up, which has much to do with everything that you're saying in regards to hormones and breast cancer, it's brought up like, why would we ever take estrogen if we had an estrogen? We were told, have been told, we have an estrogen fed cancer. Normal, typical woman goes in, the doctor says,
you. I
no,
mean,
no.
You're asking me to focus on the core issue there.
Well, it's just a part of everything you've been saying.
Exactly. Well, I want to back up just a little bit.
Sure.
It is so important that the woman deal with the elephant in the room, which she is doing. She's seeking the medical care to address the urgency called the breast cancer itself.
Yes.
From these specialists, it's unlikely that she's going to get the great information about hormones. They're not specializing in hormones. They're specializing in doing great work around cancer. Bless their hearts. My God, it's a miracle that they would take that on. What she now needs is an expert in the aftercare. And what is the scientific truth around treating a woman with hormones who's had an estrogen positive receptor site in a cancer? Well, in personal conversations with Dr. Avram Blooming, oncologist specializing in breast cancer, doing a study, he said it's a gray area. You can't answer that question. It's not like give the woman estrogen or don't give her estrogen. You don't know. That's not, it's a mystery because that's not at the heart and soul of the issue of how the cancer developed. And what he described was in any given cancer, there's healthy cells that do have estrogen receptor sites in them. And there's severely dysfunctional, dysplastic, they're called, out of control cancer cells. They don't have, they're so undifferentiated. They're the ones that are the big trouble.
Yes.
And the point I was trying to make before was long before the estrogen receptor sites were defined and brought to light and named, Dr. Blooming was out there treating women who had breast cancer with hormones, Premarin and Prempro, no less.
Which would be
getting good results. And he didn't get perfect results. Some women passed away. But he was getting good results, so much so as to make the statement women who had breast cancer, had that breast cancer properly treated, were at less risk for recurrence if they had the hormones. This was long before there was any receptor site. So Dr. Blooming is saying that the whole area of receptor sites far more gray. And it's not straightforward. Don't ever treat a woman. He treated plenty of women.
Going even deeper than that, which we know, I mean.
So the real issue for me lies in this: how can we unravel the causes and address the causes of serious illness? And best science is women who have had breast cancer and had that breast cancer properly treated are at less risk for recurrence if they're treated with hormones, Premarin and Prempro, than if they're not. That's vague. That's not including receptor site positive, but it has to be vague because cancer is so profound, it's not going to come down to better living through biochemistry.
Right.
So if you find my answer vague, I am being vague because I don't know the answer for this particular questioner. Because any illness of minor or moderate or severe consequence, you have to really unravel the individual person. And when you go on the trail of unraveling, well, how biologically did they get that illness? Well, you might as well start with the immune system. And what are you going to see? Compromises. And what's going to be compromising the immune system? The excessive stress, and often the intestinal tract and what they're eating, and often the toxic exposure they've had. So the great news is there's an explosion of knowledge about this. How to track down, how did someone get a severe illness? And in this case, how did she get another recurrence? And are you going to address the biological, the emotional, the consciousness issues that relate to this? Right down to the nuggets of, is healing possible or is it not? What do we believe? Most everyone I've ever met carries a lot of weight behind, no, I can't heal. But I can tell you, I can guarantee it from my own life and from having dealt with a lot of patients that healing is possible. So even though this woman, bless your heart, you have a real challenge in front of you, still healing is possible. And I wish you the very, very best.
And I do too. Absolutely. Having been there myself, as I always tell my story on our group, well, not always, but from time to time, having had cancer 3 times myself, I will say just this, that it absolutely behooved me to do that extra work, you know, of figuring out some of the whys and cues and clues and this and that. And
What did that work involve? Did it involve the exploration of your past? Did it involve
you
the
bet.
exploration of your emotions and your mind? Was
Yes,
it challenging to do that?
it
Was it
was
scary?
painful. It was very painful. Yes.
What do you think of that, having gone through that wall of pain?
I think it was probably one of the best things I've ever done in my life.
I love it, Carolyn.
I
I love
swear to
it.
you, Dr. Rosensweet, as sure as I sit here, I was very fortunate because I had Daryl, um,
Yeah.
and he kept telling me that I was bulletproof, and I just believed him because I was terrified. I'm
That's
serious.
great,
He's like,
Daryl.
"You're bulletproof." I was like, "Okay," you know. Um, but then I,
There's a gallery in Asheville where I live of this phenomenal photographer. His last name is Walls, and he went up to Yellowstone in the winter and he photographed the buffalo in a storm. And I learned this for the first time, maybe many of you know this, that most animals, when there's a severe winter storm, and Yellowstone sure has them, they run away from the storm. Not buffalo. A herd of buffalo will walk right into the storm. And Mr. Walls has this gorgeous photograph of a buffalo walking right into the storm, and what the buffalo have learned, that that's the quickest way out of the storm, is to walk right into it.
I understand that.
So you do understand that, and I
I
understand
well
that myself.
understand that.
I understand that myself for my own reasons. And
I remember you brought something up too that was very endearing when a woman was having chemo, I believe, or radiation that you knew, and she would say, "Mana from heaven,
yeah,
mana from heaven."
Yeah, she was German and she was in her 30s and she had breast cancer.
That struck
And
me.
her attitude when she was receiving chemotherapy that was very challenging to her, she said, and I received it like it was manna from heaven.
It's
Just,
something, yes.
different ways of addressing, really coming down to the attitude of. So anyway, perhaps
Anyway,
I can't solve this one because it's such an individual issue.
correct.
But I do want to lay the groundwork is that when a woman is in severe, let's just do some common sense stuff here. You have a woman who makes it through the whole surgery, radiation, chemo of breast cancer, and she's coming out the other side, and she's totally disabled by hot flashes, can't sleep, mood is terrible, losing her muscles, not able to think clearly because of the loss of the hormones. You might want to pause for a moment to think that that could be detrimental for her health. And everything we do in medicine and life is risk benefit.
Yeah.
So just common sense, you don't want to throw out. That's a woman who is severely disabled because of the hormone loss itself. And women who have gone into menopause and have experienced the symptoms thereof, as 75% of women who go into menopause do experience the symptoms, they're life stopping, can't sleep. Anyone out in the audience, I invite you to not sleep for 3 nights and tell me how things are going for you, let alone 3 weeks or 3 months.
Living the dream. Not.
So, how's that going to be for her recovery?
Ooh.
Severe hot flashes. Any woman I've ever met, and I have met 1,000 or more in the.
Oh no, don't freeze. Yikes. Come back.
Am I frozen?
No, you're back now.
Okay. I've spoken to so many women who have had hot flashes. Yeah, they're disruptive, but every woman endures the hot flashes. But you have a hot flash in the middle of the night and you can't go back to sleep because adrenaline got triggered, that's a different deal. And you don't get to sleep and your mood tanks and you get depressed or you get anxious. So no one can tell me that that's good for recovery.
You have a word that I've adopted. It's called raucous.
Yes, right.
Yeah, it works.
So all of these things need to be weighed for the individual patient. And the bottom line is you have someone who has cancer, it requires a great deal of time and attention and focus. And like you said, Carolyn, and there's a book out there called The Remarkable Recovery. And it's the story of these people who had the impossible health situations that they recovered from. Impossible. Stories like you don't even want to hear the stories. And
You're
they
right.
recovered from them. Remarkable recovery. And they say what you just said. In retrospect, it was the best thing that ever happened to me.
Honestly, really, truth, no BS. Really,
So
just
I know it's hard to take encouragement that what's going on for this woman, I wish she was on this call directly, that it's okay. It's so easy to judge yourself. It's so easy to say that this is wrong and should not be, and I'm wrong, and there's something wrong with me. And that is not true.
I agree.
And I want to tell you, as a young doctor, I thought it was my mission to cure everybody that came to me. And I very quickly abandoned that because I realized I did not have that ability. And basically, what I was doing, I was judging that the illness they had was wrong and should not be, and we're there to vanquish it. And I hope I'm not belaboring this, but this is a very deep topic. And so I started paying attention. I said, well, I certainly don't know how to do it. So let me see if I can figure out what's going on here. And invariably, I saw the wisdom of the illness. And the other thing that I picked up, which was an extremely important skill, was not to judge the illness as bad and wrong.
That'd be a good name for a book, The Wisdom of the Illness.
Yeah.
Yeah.
It's we all wish that life on earth was easier, but we don't want to call it wrong because in retrospect, just like you said, Carolyn, there you are, you're living proof of this, that it was one of the best things that happened to you. Well, how could someone in the middle of recovering from cancer like this woman for a second time say, well, it's the best thing that happens to me? It's tough to say, but I just want to say that from my experience and from the best teachers I've ever had is it's not wrong. You're not bad. You're
No.
not bad. You're not wrong, patient that is having the recurrence of the breast cancer. It's an honorable, natural process. It's funny to call it that. Yes, it was not meant to be this hard, but sometimes our lessons have to come in a little stronger because we're not picking them up on a subtle level. So if it's at all possible, come face to face with any part of yourself that's judging yourself as bad and wrong, and embrace to the best of your ability, accept yourself for exactly where you are. Make an effort, get support to accept yourself right in the midst of that cancer and the recurrence. You
You
got to become the big tent that surrounds yourself and accepts all that's going on because it's not invalid. And there's mysterious ways that we don't know how the soul and the heart actually opens and gets refined. But it does. And illness is part of it. And I know I've said a lot of words, so I'm going to go silent here and maybe on to the next question.
We'll go on to the next question, but I just want to interject this. I remember you had like a flu or something or whatever, and in our interview, you said, I was so grateful for that flu. I mean, like,
Yeah.
and
And of course, flu is a whole different world
yeah, of
than
course.
recurrent cancer.
Yeah, of course, and I'm not trying
So I
to
don't want to equate the two.
No, 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 no. I didn't mean it
Yeah.
quite like that.
I know you didn't, but I did want to clarify that.
Yeah, thank you for that. It was
That was the simple version of
very,
this
very.
woman in a much different version.
Yeah. Okay. Well, thank you so much, Dr. Rosensweet, always for your amazing wisdom. Whoo-wee. Okay. Could taking hormones affect our blood pressure and make it low? I'm trying to find my own balance with estrogen that is optimal. I seem to be low in the estrogen arena. I'm using the patch, but I can't seem to get my estrogen up. 2 patches is too much. 1 patch is too low. My blood pressure is down. I don't know if the two are equated. I'm also taking testosterone and progesterone. And also, my SHBG is really high, which could be a clue as to why my estrogen is really low. And I'm wondering if you have any thoughts on any of this.
Yes.
Oh, good.
Next question.
Yeah, I just wrote yes.
It really speaks to such a common situation where there's more moving parts to this woman's menopausal situation than anyone could ever dream of.
Yeah.
And that's the way it is. Midlife, by midlife, there's been a lot of water under the dam, and or under the bridge. I forget which one it is.
Could be
And there's
both.
been a lot of different challenges of nutrition and toxicity and too little or too much exercise and a dysfunctional response to stress. So there's been a lot of systems in our body that have taken that are challenged, and they're not functioning like they did when we were 20. And the low blood pressure, well, I sort of smile when I think of the millions and millions of people that have high blood pressure, and that's an issue.
Yes.
And this woman's got low blood pressure, and I know it can be inconvenient, but this is the least of your concerns, unless you're about ready to faint. So I'd like to know what she means by low blood pressure, but I took on the easiest issue of all. What I hear is these hormones are not being dealt with the level of precision that's often called for. And this happens. I'm not for a moment declaring that the approach to trying to manage her menopausal symptoms with the patch and with the testosterone hasn't had a great deal of rationale behind it. But here she is, sometime into it, and it's not quite working. And that's why I started out by saying this is not an uncommon thing. The complexity of what the ovaries and the brain and the hypothalamus and the pituitary used to do, the symphony that they had going, is just staggering. And now we're trying to replicate it. Excuse me. So sometimes it really needs the next echelon of expert. Like, I'm a computer lover, and I've turned towards technical support in computers many times. And I'm just amazed at the computer system that I use. They have this excellent technical support team. And I'm always able to reach them, and they always are very smart. But since I've been doing this since 1984, computers, there's been times my computer challenges were so challenging that I had to be elevated, that's what they called it, to a senior advisor who had the next level of education and experience, and invariably they'll solve it. And that's probably what's going on, is that you've reached the limit with your current or your current provider. What I find is if you just keep on paying attention and keep on making adjustments, you figure it out sooner or later. So if you've got a good team going with your current provider, you can figure it out. What happened? You were on estrogen too low, and then you were on estrogen too much. So you're well on your way. You're starting to get an internal feel of too low and too much. You got a lot of experience under your belt. The next step is, because you have that much experience, you should be able to find the optimal amount of estrogen just by clinical symptoms alone. You know what too little's like. You know what too much is. You got a scissors, you can cut up that patch. Now, I don't work with the patch, so I don't want to stick my foot in my mouth about patch, but there's other ways to receive bioidentical hormones. And in fact, when you get into the compounding pharmacies, you can do a level of precision that is staggering. You got infinite number of variabilities of milligrams per milliliter and ratios of estrogen, for example. So you might be on the proper path. I encourage you to stick with it, because along the way, these mistakes are not bad. I've walked these kind of situations out with many patients where I listen to what's going on. I get an idea. Why don't you try this? Why don't you try cutting a patch in half and adding it to a single patch? And then I say, and call me in the morning. Email me, text me in the morning. Because
Text me in the morning.
It doesn't matter what my idea is. It matters what happens from the deploying of that idea. How does it play out? And so when you do that kind of teamwork, provider and patient, the two of you figure it out. And the thing that I want to encourage you to do is take the time to figure it out. There's a certain percentage of women that it's pretty easy to figure it out. But there's a certain percentage of women, there's a greater complexity to it. Like I think in terms of anywhere from 3 months to 9 months with a new patient newly in menopause. Because I know all things are possible, and you just walk it out. So I recommend that you read our book, Happy Healthy Hormones. You're going to get a real roadmap there. Now, sometimes what's happening is you're being worked with by a medical professional that has a broad base and expertise in a lot of different things, but they haven't hunkered down on hormones, and it's time to find a specialist who has. But that's their bread and butter. That's all they're doing, because they have faced and worked through many more complexities than when you've got a broad-based practice. You can't get your arms around everything. You just can't simply do it. I tried. Couldn't do it. That's one of the reasons I hunkered down to focus on one specialty, hormones. So take heart. It's solvable. Your body knew how to solve it. But you got 4 ovarian hormones. These are some of the most powerful hormones in your body. And the balance and the amount of each one of them, you're naming them testosterone, good on you that your provider knows that testosterone is really important. Progesterone is really important. And then you got thyroid in there. And we're just talking about hormones. Sometimes when things aren't working out, we got to look at other things. What is that hypoglycemia a clue to? Well, I'd certainly want to know if you've got glucose dysregulation to the point that you're pre-diabetic and you need to address that. So I wouldn't be, I know it is discouraging when it's tough to figure out, but a lot of things in life are challenging.
Very much so.
So what I assert is there isn't a single menopause case that if a woman will stick with it, we team it, that we can't solve. And sometimes it takes longer. Sometimes it takes a couple of years. That sex hormone binding globulin being elevated, whoops. But it's addressable. There's 2 things that need to be done. One is there an obvious cause, and how elevated is it? And second thing is, does it need to be treated? Or is removing the cause? So do you have too much thyroid, for example? There's something that's drove up that sex hormone binding globulin. It could have been that you were on the birth control many years ago, and it just stayed up. It just never went down. So it needs to be addressed, and it can be addressed by danazol. I know I've thrown a flurry of words at you, but the main thing I want to say is stay with it. These things are solvable.
Yeah.
Sometimes, and this is the most daunting of all, and it comes down to a very core fundamental in medicine, that illness is a natural process, and it's a signal, and behind it is an intent to get our attention. And it really wants to get our attention. Our being is wanting to get our attention. And our being is wanting to get our attention to the point that we start asking a question. And the question that our being wants answered is, what in the heck is going on here? The problem is our being wants the real answer. And it's not going to stop disturbing us in some way until we ask the question, what in the heck is going on here? And we come up with the real answer. So sometimes this takes us into our life. Like sometimes what's throwing off the hormones is the stress hormones. Cortisol, adrenaline. Well, why are they throwing you off? Because there's stress. And sometimes, I've seen situations where people were failing to tell themselves the truth about the relationships that they were in, that there was a severe dysfunction going on there, and it was extremely stressful. Well, you as a human being, if you've got a major relationship challenge that's not being addressed, and you just continue to avoid it, the universe is not going to let up on the feedback.
No.
It's going to continue to try and shake you up. Like there's, just for an example, there's women who are in relationship with alcoholic. And I have no specific judgment on an alcoholic, but I do know that it won't work if the alcoholic will not wake up and realize the untoward effect they're having on everyone in their lives, including themselves, and seek help. And some women won't take the stand and say, look, I love you, but I love who you are as a soul, but I don't get to see who you really are. I just get to see your pain and your attempt to anesthetize yourself with the alcohol. And I need you to seek help, to stand up and say, I need you to seek help. And I mean it. And these are the kind of stresses that if you don't address them, you're not going to stop getting feedback. It's like whack-a-mole. Okay, you were able to take a medication, you're able to take morphine and quiet down the pain of a tough marriage. I'm just being facetious there. You're able to take Xanax. Let me get
Totally
more.
get that. Totally get that.
You're able to go on Xanax, and all of a sudden, your stressful world just seemed a little more mellow to you.
Yes.
But no, you have to. Life will not. Life is powerful, and life is real, and it's not going to let up until we solve the issues that face us, that are calling us to what? Happiness and love.
Correct.
We want these issues solved so that we can be happy, have fun, love, and experience the miracle of other human beings, of nature, and of being alive. All this stuff is shaking us up so we can find our way home to the truth of who we are.
Yeah. Yeah.
So
I know you have
I have an early departure today.
Well, I wanted to call it a hard stop. I just got used to that word or those two words. An early departure. Well, here. Dr. Rosensweet, amazing to see you. Always wise words, always that we carry with us now for 2 weeks. Until the next time, I think we got to just about every question, which is amazing. And with the bonus of your amazing philosophy that you're not adverse to sharing with us. I find it extremely endearing and very, very helpful. And I think many do. And that's one of the things that makes you so, so special, at least to me in my life.
Thank you, Carolyn. That's very kind.
Well, it's something you well know. I'm always telling you. Thank you for being here. Thank you, everyone, for being here. We will be here in 2 weeks. And in the meantime, write to me. Lots of changes going on, and we'll get into all that next interview. And then the interview after that, and after that, and after that. How's that sound? Yeah.
Very good. So bye, everybody. I'll see you in a couple of weeks.
See ya. Enjoy. Bye.
Bye-bye.